My name is Josh Halpern. I'm a reproductive urologist at Northwestern Medicine. We have a multidisciplinary team which is really focused on helping to shepherd men through their treatment for erectile dysfunction. That's a team that consists of doctors, nurses, and clinical coordinators who are really there for our patients with sexual dysfunction. And so, for example, we have a lot of men who don't respond to PDE5 inhibitors and plan to go on intracavernosal injection therapy for erectile dysfunction. Now, it's obviously pretty anxiety-provoking to put a needle in your penis and to inject yourself with a pretty strong medication. And so we don't leave our patients hanging out to dry. We will bring our patients in to meet with one of our dedicated nurses who will conduct a series of teaching exercises with them to ensure that they feel comfortable injecting, to ensure that they're injecting the appropriate dose. We really feel that this team approach and a stepwise education really helps our patients feel comfortable as they begin treatment with injections and really improves their outcomes in the long run. You know, our team is doing a lot of research in the space of both sexual medicine and also andrology. And so one of the things we've been really interested in is the effect of diet on the male reproductive system and on male sexual function. We've actually conducted 2 studies recently looking at the effect of some of the more popular diets, things like low-fat diets, on erectile function and on a man's testosterone levels. Interestingly enough, men who were adhering to very, very low-fat diets, or the Mediterranean diet, seem to have slightly lower testosterone levels than men who were not adhering to those diets. So there is this difference between testosterone between the 2 groups. But interestingly, when we look at erectile function among men who are on these low-fat and Mediterranean diets, it's actually no worse than the erectile function of men who are not adherent to those diets. So there's a little bit of a disconnect there. So what diets should men be pursuing if they're interested in improving their erectile function? Well, pretty much anything that's going to be good for your heart is going to be good for your penis. This is a really exciting time in the field of sexual medicine and erectile dysfunction specifically. And one of the reasons is because there's been a lot of talk and new development of new approaches towards treating erectile dysfunction. So a couple of things that have really gained a lot of attention are shockwave therapy to the penis for erectile dysfunction and the notion of stem cell therapy for treatment of erectile dysfunction. And while we're optimistic that eventually the research might support the use of these approaches in our clinics, it's important for physicians out there to know that these are not FDA approved treatments, nor are they recommended treatments by our national societies, for example, the Sexual Medicine Society of North America. And so we're very cautiously optimistic about the next couple years and the potential future breakthroughs in our field, but we're also very careful to ensure that our patients are only getting FDA approved, very well studied treatments that we know are going to be efficacious and not do them any harm.